those two other countries do, because I also worked for Sandoz.
Okay.
They also look at market share. So if they think they can get a big market share because they have a nice price, or the market price, the pharmaceutical purchase price, is high, that means that they can give a lot of discount on their price. Because what they do is not tendering business, they do package deal. So they say, dear pharmacists, come to us. From the whole generic market, our coverage is 95%. And if you take everything, because you have given us your numbers, you have given your volumes from last year, based on that, we can make a price calculation and we give you this offer. Are you accepting? Yes or no? Yes. And then they need to be compliant to the volume and all these things. Then you can imagine if a product is going to be launched and it's a big one, like rosuvastatin. As Mylan, I said I don't want to have it, but I needed to have it. But for Teva and Sandoz in the Netherlands, it's very important to have. Because the market grows with it. They need to have in order to compete on the same package to get the same discount.
Gotcha. I see. Okay. And so it seems like with the Zomiltriptan nasal spray, if it falls into a different bundle, as you've mentioned from, the oral tablets, that there may be a higher price that's afforded for something like this. Okay. Okay. Gotcha.
I would say it's easy to get inside the reimbursement system. To get market access. First of all, and it applies for tendering, which I'm even not sure. They will only do the oral dose and the capsules.
Gotcha.
And then the nasal spray can give still a high value.
Got it.
If you have small business guys, they can make nice business deals with the wholesalers, like Allianz or all these guys, Walgreens. But so if you have a patient within your pharmacy, because they are the owner of the pharmacy, you say they can get or a tablet or they can get the spray, both is being reimbursed. If they can sell a nasal spray for 80 euros, 80, and you give them a nice discount, they get much more euros in the pocket than they give when selling a tablet.
Absolutely.
That's why I see the big advantage. But I don't know if everyone thinks like that.
It makes sense though. Okay, and then moving more towards a development perspective, with something like a nasal spray, obviously it becomes a little bit more complex from a generic perspective because you need that delivery device. You either need to have it in-house or to license it or work with somebody. Are nasal sprays something within, Viatris's wheelhouse? Is that something that you're not concerned about if you were to pursue this, or is that a major consideration, who you might get the device from or where you would get the device from? What do you think about that versus a tablet, which is obviously much simpler?
No, I mean, for me, as a decision maker at the company speaking, no, I would not mind so much if I had to have a supplier. The only thing is more important, but that's quite obvious, is the supply guarantee. So it needs to be a supplier that can guarantee that, and then all the T's and C's, if they're negotiated well, I'm happy as Larry.
Sure. Okay. And so the device is something that you would outsource or you would license for. It's not something you would develop in-house necessarily.
No, not necessarily. No, not at all.
Oh, okay.
I can't recall like typical examples, but we had examples that in-house we were more expensive than an external supplier, and then the whole business goes to the external supplier.
Gotcha. Do any companies come to mind when you think of a potential supplier for a nasal spray device? Any companies that are good at that you'd feel comfortable working with, or is it something you need to evaluate?
From the top of my mind, no. I really need to dig into it. I remember one that was in the UK, but I think the name changed. They had lovely nasal sprays. They were
see. Okay.
Would not be say I know one that is extremely good at it. No.
Gotcha. Okay. All right. So I want to, with the second half of this call, I want to switch a little bit over to more of the pain management area. So we're also kind of evaluating some of the lidocaine patches, as well as the capsaicin pain patches. Are you familiar with those two areas?
A little bit, but let's see.
Okay. So, my first question,
it's like the fentanyl patches, these kind of things.
Yeah, exactly. But this is, so lidocaine, obviously, you're just kind of a numbing product, and capsaicin is, it attaches to the pain receptors like you get with spicy food and reduces basically pain localized in that area. So, yeah, it's kind of like a fentanyl patch, just a different product formulation. So I've got a few questions, and we'll see how far we can get here. But so has the merger with Upjohn led to pain management and kind of post-herpetic neuralgia becoming more of a priority within the combined company? Kind of given that Upjohn is an expert in this pain management space. With I think they've got like Lyrica in its portfolio, for example. So do you see kind of this merger kind of making the combined company head a little bit more towards this pain management space, or has it been pretty neutral?
I would say pretty neutral.
Okay.
Yeah. Okay. I cannot say it yet. I mean, we're pretty busy with integrating, and of course we are. But the portfolio is still something that needs to be done. We have ideas about it. But it's not that we say, oh wow, we can clearly see the pain opportunity or the opportunities in pain management through Upjohn, let's say.
Yeah, I see. Okay. Okay, and this second question is a little bit more specific, but so Mylan, I believe, has a generic lidocaine patch that they market in the U.S. And our question is, is it of interest to Mylan or Viatris, I suppose, now to expand this lidocaine patch, or would it be of interest to Mylan to expand this lidocaine patch outside of the U.S. market? Or do these kind of patch products not have as big of a addressable market in the EU, such to the extent that it wouldn't be an attractive expansion for the company?
I need to think a little bit on this one, because the plasters are also sometimes clustered in the system.
Yeah.
So I don't know if they can be unique or not, or how much, when are they combined in the same cluster in a therapeutic area or not.
Sure.
But I think plasters in general, if I look at the fentanyl, they had a wonderful journey.
Yeah. Gotcha. And so fentanyl patches are kind of the market standard for localized pain, or more localized pain in Europe right now, or what's, where is the market at in Europe?
Hello?
Oh, can you hear me? Can you hear me?
Hello? Yeah, now I can hear you.
Okay, perfect. So my question was, are fentanyl patches kind of the, the market standard for localized pain in Europe? Or are there other kind of patch types for this localized pain that you see pop up across Europe?
No, I think I would talk about strong opioids like fentanyl, morphine, oxycodone in that area, or not?
Yeah, I guess I'm not really talking about like a systemic treatment. So more so, I'm thinking more so just this patch that's applied to the skin that would be more for an isolated issue. If you've got back pain or some other type of, post-herpetic neuralgia is one that always comes to mind. But, I'm wondering, if you're familiar with kind of what the market standard is in Europe, if that's like a cheap industry, right? So if we're talking about a bundled type of product, if what's existing right now is the standard of care is pretty cheap, and so that's why it's not attractive, or, can you speak to any of that?